I want to start with a story this morning. How many of you have had a course in child development? A specific course? Okay, that's what I thought. That makes this even harder to make fun and interesting. Because most of you know this stuff better than I do. I recently have had the opportunity to meet a 10-year-old boy. He has diagnosis of reactive attachment disorder. There's some suspicion that he's been sexually abused. He recently exposed himself to another child. A little girl had him touch her, he touched her. Don't know the complete context of all of that. His parental rights were just relinquished in December. He is quite charming little boy, and yet he experiences quite a bit of failure in school. He'll go to respite care, and he's a very charming, delightful little boy. He remains in a foster home, and early on he does pretty good, and then his behaviors escalate. And people don't want him around anymore. He was first removed at 4 months. In 10 years, he's had 23 placements. His longest placement is about 14 months when he'd been returned to his mom. Although she didn't keep him, he ended up in guardianship with an aunt. I don't know the circumstances around why the guardianship disrupted. I think in that 10 years he's been with mom about 4 times. So I get the kid now, I get to meet him, I interact with his foster mother a little bit, who was his first foster placement 10 years ago. She even had the astuteness at that time to say, I want mom to come into my home, I want her to be here. So there were some good opportunities that happened. I have no idea where it broke down or why it broke down. But now we're faced with the aftermath of trying to figure out how to help this kid. He was in a psychiatric hospital for 2 weeks the beginning of January. The psychiatrist recommended residential treatment. Magellan, the Medicaid provider, said no. And so he goes back to foster care. And he's been there for 3 months, and his behaviors are escalating. So what do you think we did to that child's development? The video sets up the whole day beautifully. We now know what we've kind of known intuitively for a long time, to a certain degree, that something bad happens when we have to take kids away from their parents. You know, I've sat and cried in depositions when I have to say parents shouldn't have their kids back. So I get a little nutty and a little passionate about this stuff. And so I really welcome the opportunity to be here this morning. You know, this is just one tragic story of, we all know this story over and over. The kid needs somebody. I told his caseworker the other day, I said, and I know what he needs without even doing the assessment. He needs a family to step up and say, no matter what, I will take this kid, he will be mine, and I will commit to it. And all the pain and agony that goes along with that. Because he will bite, he will scratch, kick. You know, he will prove to everybody that he's not worthy of a loving, consistent relationship. Now I want to shift for a minute. I want you to think about the last time you interacted with, played with, or held a child 3 or younger. Think about what you heard, what you smelled, what you felt. I want you to turn to your neighbor and talk about that a little bit. Talk about that experience of playing with that child. All right, the energy in the room speaks for itself. I mean, we get this stuff. We understand it. And so what I'm going to try and do is just give you some highlights of child development, talk about the social emotional piece of it. I've also had the opportunity the last couple of years to be a part of starting a state association of infant mental health. One of the challenges that I have experienced over the last 5-10 years is when I have interacted with social workers, I say, well, you know, they'll be calling me about a kid 10 or so, and I say, well, what about the 3-year-old? What about the 18-month-old? And the classic response I have gotten is, what do you do with an 18-month-old? You know, which always gives me an opportunity to do another commercial. And yet people still don't get it. So birth to 1. Growth in the brain is incredibly rapid. The human infant is the most dependent creature. Completely, totally dependent. Sleeps, eats, poops, wets. That's about all it does. 4 to 6 months, they begin to recognize their mother. They know their smells. They know the father. Beginning to have a little bit of anxiety about separating. 7 to 9 months, we start to get more what we call object constancy. Their memory starts to work a little bit better. You can play peekaboo, a little bit of that hide and seek. When you put the blanket up, they get a little, you know, disoriented and they want to look for you, so that's beginning to emerge. What is that important for in terms of child development? Attachment. That's the beginning part where kids really begin to form that strong bonding and attachment. As we talk about these, think about that interaction that you had with that child recently, and think about what those dynamics were about. What's your relationship with them? Are you a parent? Are you a grandparent? Some of you play with kids all the time in preschools and those kinds of things. But think about the quality of your interaction, the quality of their interactions with other people, and what is the level of relationship that you have with them. In terms of relationship with their mother and father, the quality of their relationship with other caregivers, and how do they respond to different people. 10 to 12 months. Begin to respond to their own name, the way bye-bye. Some kids will start to talk, feeding themselves more. They become more independent, beginning to talk a little bit more. If kids aren't talking by then, begin to wonder, but it doesn't necessarily mean there's a language delay. Language emerge, you know, child development, we know that walking emerges 9 to 18 months. So there's a broad range of what we would say is within normal limits. 12 to 18 months, they obey commands, repeat a few words, become interested in their mirror image. By now they're more separated from their parents. They're beginning to have a sense of identity. Feed themselves, increased independence, moving around more. You see a lot more separation anxiety. So the image of their caregiver is embedded in their mind. So when that image is gone, they become anxious. It's painful. 2-year-olds. What do you know about 2-year-olds? Why do kids say no? It's an easy word. They can, because they can, that's right. Why do kids say no? They hear it all the time. Testing boundaries, yeah. Is no a powerful word? Yes, it is. Yes, it is. And a 2-year-old begins to have a sense of some power. Words have power, power and control. It's important cause and effect kind of thing. If I do this, I'll do that. If I say no, what's going to happen? Depends on the caregiver. 2 to 3-year-olds. A lot more explosion of language. increased motor abilities, jumping, running, still have a fear of separation, more range in emotions. It's about this time kids can begin to have a little bit more fantasy, and so you'll start to get more dreams. We'll see more fears and anxieties emerge. Sense of humor. Start to play tricks on you. Fun-loving. You'll see that anger happen. It will happen in a flash, and 30 seconds later, what happens? It's over. It's over. My youngest, I have to be careful about what stories I tell today because I don't have permission from them, but I'll do it anyway. Stefan is 20, and I didn't think the kid was ever going to stop having tantrums. But he has two older siblings, one 3 years older and one 4.5 years older. And Stefan was quite good with the emotion, which was designed to get primarily his brother in trouble. And Cindy was in Lincoln with them and had the opportunity to go out to dinner this spring. And it was Stefan and his childhood friend Jason and Nick, who's 23, and his buddy, who's the brother of this Stefan's other buddy. And they used to play football and stuff in the front yard all the time. But you would hear, you'd get a bump and there'd be wailing and this and that. But Cindy said she took great delight in listening to them talk about, reflecting back on those moments. And some of it was manipulative. Some of it was Nicholas actually thumping him. But the emotion, there's power in emotions. And so part of that relationship developmentally is how we help children learn to soothe those emotions. Because if a kid falls down and they wail and I immediately respond, what have I done? I've reinforced the wailing. And so the message there is you are not capable of soothing yourself. Now, does that mean if the kid falls down and is bleeding profusely, I'm not going to respond? No. But I have to be careful too because what's my goal as a parent? To raise healthy, responsible taxpayers that are going to be able to take care of me when I get old. But most of the kids that we see with have very poor emotional regulation. They get dysregulated very easily, and all of that is grounded in development because their needs haven't been met. Their emotional needs have not been met appropriately. 3 to 4-year-olds, you see more affection. You start to see a little bit more of the dynamics of their personalities emerge. There's a great book by Alicia Lieberman. This one, The Emotional Life of a Toddler. And it goes through the early lives of children and it talks about them. And this is all natural, normal development stuff. But kids are easygoing. This is temperament research. They're either easygoing, they're slow to warm, or they're maybe more difficult. And we know that often by 18 to 24 months you get a sense of that. And that affects how they're going to be able to handle stress, how they're going to interact with other people. But we know one of the things that happens is that if I have a mom who's really easygoing and I have a child who's a difficult child, then that presents some challenges for development in terms of how that kid's going to get their needs met and how mom's going to get their needs met. If I have a really colicky baby and I have a really inexperienced mom, what happens in that situation? I want you to think for a minute about on the video, that situation, the experiment with the still face experiment. And when the mom was still and the baby got no feedback, you see how reciprocal that relationship is. Not only for the infant, but also for the mom. So if the baby is fussing and crying and wanting to push away, what happens for the mom or the dad? Anybody ever had a colicky baby? What were your feelings? Anybody want to share? Frustration? Inadequacy, yes. Why can't I calm my baby down? Failure. What's wrong with me? Exhaustion. Where's grandma? Right. Exhaustion. Anybody feel angry? Hostile? Have really ugly thoughts? I mean, it's okay to be honest about it. I mean, that's how child abuse happens. This ugly stuff comes out of us, and we don't always have the skills to moderate those responses. I remember as a dad, now, I was not raised to be a quiet, patient child. My mother is Italian. She was Italian. She's dead. And she was a lady of contrast. She was mentally ill. She would spank me with a fly swatter. The end would come off, the metal fly swatters. The end would come off, and then she would ask me why I broke her fly swatter. I think she may have had a mood disorder. I never knew which mother would be there. Would I come home to the warm and loving mother, or would I come home to the mom that was madder than hell about something that I probably had nothing to do with? But it affected me. I know that I was loved. There's no question in my mind that I was loved. But I also learned to believe that I was a rotten, horrible, no good child. Was I abused? Yeah, probably. Did I survive? Yeah, with a lot of therapy. My point is, we're all capable of ugly stuff. And we've had opportunities to improve that a lot of the people that we work with haven't had. And I think about this 10-year-old that I was telling you about. And if we could rewind and go back to that 4 months when he was removed, we're smarter, we have more resources. Could we make it different for this kid? I hope so. I hope so. 4 to 5-year-olds become more social, prefer to be with other children. Language, they speak clearly, they ask questions, they're curious. Motor skills by now are really pretty good. When you do adaptive behavior inventories, when we do assessments, it's at this age where it's the last time we really assess adaptively motor skills. They tend to drop off unless we know there's problems, and then they're a lot more obvious because motor skills are done. They can run, they can jump, they can climb, they can do steps. Now we're talking about normal development. Normal development. All right, attachment. Attachment, when we talk about infant mental health, basically it's about 3 R's. It's about the relationship, it's about the relationship, and it's about the relationship. And people that know me get sick of hearing me talk about that, because about every meeting I go to, I put in a commercial for this infant mental health piece. But what they talked about in the video with the brain and how important it is, experiences wire the brain. Because you're here today willing to expand your mind and learn new stuff, you're changing your brain. The dendrites on the end of your neurons in your brain actually are busy wiggling, creating neurochemicals, and you're expanding the density of your brain. One of the ways you inhibit aging is you learn new tasks. You challenge yourself. Write with your left hand. Get dressed in the dark. Learn to play the piano. When you learn new tasks, you learn to challenge your brain in new ways, which keeps your brain active and alert. Take fish oils. You know, be active. That's all good for your brain. Attachment is this, it's the relationship. It involves soothing, comfort, and pleasure. The loss or threat of that person evokes distress. The child finds security and safety in the context of that relationship. Okay, implications of that. It sets everything up for the future. If you have poor attachment, you basically end up having minimized ability to have healthy relationships. Healthy attachment equals a high probability of healthy relationships with others. Poor attachment equals a host of emotional and behavioral problems later in life. It's just that simple. Bonding is the process of forming an attachment. It's genetic and biologically based. It's critical for survival. If the child can't attach with the mother, they're not as able to survive and heal and be a part of the tribe. Healthy mothers experience a physical longing. I mean, mothers, you know this. I want to hold that baby. I want to gaze in their eyes. I want to smell them. I want to stroke their face. I want to touch them. They can puke all over you and you don't care. Right? I mean, you go, oh, yuck. But you tolerate it. You don't say, well, God, I ain't doing that anymore. Now, so that's the healthy part. I had an experience I've never had before in the last, it was about Christmas time, I suppose. Had a family in my office, and we're playing and interacting. I'm talking to the mom. I'm trying to kind of look at the dynamics of the family relationship. And the mom says, well, Billy's not feeling so good. And I said, oh, well, okay, well, that's all right. And I'm thinking, okay, we maybe better get him out of here. They're contaminating my office. Next thing I know, his tummy's hurting. And so, you all right? Mom just kind of sitting there clueless. All of a sudden, he throws up all over my floor, and it looks like it's got orange Kool-Aid in it, you know. And I'm like, oh, God, okay. You know, the universe is constantly presenting me with new experiences to work on patience. My favorite poster is the two vultures sitting on the dead tree in the desert. And the other one's got his head cocked to the other one, and he says, patience, I'm going to kill something. My children have taught me patience over the years. So, but the point is that Mom did nothing. She ran out of the room. She said, I can't do this. I can't do this. Well, it was a gift to me to help understand part of what was going on with this family. So one of the treatment recommendations was Mom needs to be more attuned to her children and present to them. And all the kid said to me was, Mom won't take me to the doctor. And it's reciprocal. We saw this in that little video clip about the experiment. It's incredible. We wouldn't think, I mean, it's just so powerful to think about how much infants can learn and how they learn and what happens for them. It's a reciprocal positive feedback loop where attachment develops. It's in that loop. And so when that gets broken, that attachment is severed. It's challenged. It becomes broken. It's the nature, quantity, pattern, and intensity of early life experiences that express genetic potential. So the potential for babies to be attached is genetic. It's biological. So we know that the brain develops because of experience. If they don't have the experiences, the neurons don't develop. There are neurons in the brain responsible for certain sounds. If babies don't hear those by, I forget, they call them critical periods, but if babies don't hear those by certain time period, they cannot develop the ability to perceive that sound. So there are cultures with languages that have sounds that we do not have, and if you try to learn that language, you can't hear that sound, you can't reproduce it. And it's because your brain missed the opportunity to hear that sound. So when do we teach language in the United States? You know, that's why the rest of the world is so much better at being multilingual. They learn it simultaneously all the time. It must be predictive, responsive, nurturing, sensory enriched, touched, stroked. The touch is the most critical part of the attachment process. How many of you remember seeing the rhesus monkeys experiences? The wire monkeys? Anybody ever seen those videos? A few people. I've got a little clip I'll show you. Eye contact, physical proximity, kissing, hugging, you know, all that fun stuff. You heard him talk about oxytocin. How many of you, well, moms, you've all been there, but how many of you menfolk in here were present at the birth of your children? Yeah. Moving experience? I mean, there's nothing like a woman in transition, but you know, you just feel it's an incredible experience. And there's neurochemicals that are responsible for that. It's this oxytocin stuff. Oxytocin, we know now, even in relationships, that our brain begins to secrete some of that with hand massages, back rubs, touch, warm, even between significant partners. We need to be touched. It's important. It helps us stay connected to each other. These neurochemicals lead to normal organization of the brain systems responsible for attachment. The brain develops 90% of its size between birth to 3. Now, the brain doesn't completely end its development, formal development, until like mid-20s. There's a process called myelinization. That is the insulation around the neurons. And the last part of the brain to myelinate or finish wiring, the insulation, is the prefrontal cortex, which is the front part of the brain. Do you know what the prefrontal cortex is responsible for? Executive functioning, reasoning, judgment, emotional regulation. Why do teenagers make us crazy? They have underdeveloped prefrontal cortex, and yet we expect them to function like adults. It's why they make stupid decisions. It's why some of us still make stupid decisions. We haven't finished wiring our brains yet. Majority of systems and structures are in place, will be responsible for all future emotional, behavioral, and social and physiological functioning during the rest of life. So it sets up everything for the rest of life. That's a cell beginning to mutate. Not mutate, but divide. So you see, mutate, mine probably mutated. My mother would have told you, yes, you were a mutation. But you see this little thing developing here. I just like this because that's already the early beginnings of the brain. There's this thing that becomes the neural tube. As the cell divides, it begins to form this little neural tube, which begins to continue to develop and becomes the brain. It just continues to wrap around. A couple of interesting things about why this is important. As the brain develops, those neurons move or they migrate, and they have a process called cell specialization. So some are for language, some are for motor, some are for vision, some are for higher level reasoning kinds of functioning. So when they're bathed in alcohol, the cells migrate beyond where they're supposed to be, which leads to a lot of prefrontal cortex damage, impulse control, emotional regulation, higher level thinking skills, which is what we call fetal alcohol syndrome or fetal alcohol effects. Interesting stuff. You think about the effects of methamphetamines or cocaine and those things. We know that those affect respiratory, cardiac systems. And so it's just, that's where this all has really early impact. There's 3 basic centers to the brain. There's the If you think evolutionarily, everybody has a brainstem. That's what regulates your temperature, your breathing, your heart rate, and those kinds of things. The middle part of the brain is the limbic system. That is all of the neurons that affect our ability to relate to each other. This guy, this Chandler out of Colorado, has taken this model. It's called, the model's really triune brain, and it would be reptilian brain, mammalian brain, and neo-mammalian brain. And he has taken it and laid on this the survival reptilian brain, the puppy system, and the computer thinking system. Because the newest part of the brain, the outer layers, is our thinking. It's the cortex. So, anybody in here ever been angry? Didn't think so. I not only have an Italian temper, I have a Danish temper. The quiet, stoic Dane and the hot mama Italian was very interesting at times. I have learned, my frontal lobe's finally myelinated, and I have better impulse control than I did maybe 6 months ago. I still lose it once in a while. But why do we lose it once in a while? It's because when I feel threatened, when I'm tired, when I'm dehydrated, I'm not at my best, my emotional center kicks in. That limbic center kicks in, and it literally shuts down the rest of the brain. And I cannot think. It's harder to stop. It's harder to go, okay. You've seen that poster about the definition of stress is controlling that urge to take somebody, and I mean, it really is true. Our frontal lobes allow us to do that. But so many of the people that attention deficit disorders, the three big symptoms are impulsivity, hyperactivity, and inattention. All affect our ability to think and reason, attend and respond. 80% of people in our prisons have attention deficit disorder. That's some studies will say that. And most of them weren't treated effectively. Now, it's not quite that simple, but you can make those kinds of connections. The limbic area of the brain deals with stress. It has enormous influence on emotions and memory, and the limbic system is often referred to as the emotional or mammalian brain. Everything goes through the limbic system. And so, think for a minute about something that startles you. When you get startled, that's our fear or our protection response kicking in. It's the stress response. And we have two dominant reactions. You know what they are? Fight or flight. And so we don't stop to think about that. Because if we did, we'd be dead. Because if I hear something coming and I stop to go, I wonder what that noise is, evolutionarily, there's a better chance I would be dead. So I'm either prepared to fight or I run. And so what happens to your body? Your heart rate goes up, blood goes to your extremities, your alertness is increased because you're ready to either fight back or you're going to run. Well, that happens in babies too. That's where the cortisol, remember they were talking about that stress hormone cortisol? That's what happens when we get stressed. Whenever you perceive a threat, imminent or imagined, your limbic system immediately responds via your autonomic nervous system, which is the complex network of endocrine glands that automatically regulate metabolism. That's a cool picture of a brain right down the middle. I like this stuff. Severe emotional neglect during early childhood can be devastating, causing children to lose the capacity to form meaningful relationships. You ever been on school grounds, campuses, where there's sidewalks everywhere and yet there's paths where people take shortcuts? You know, I've always thought that architects and engineers shouldn't put in any sidewalks for 2 years and then just see where the traffic patterns are and then put sidewalks there. But memory and life experience is like that. And so if you try to remember a phone number and you just say it to yourself once and you walk across the room and somebody says, "Hey, Mark," and you talk to them for a second and you try and pull up that number, it's gone. So you say it over and over, you know, when you have to remember things. Bonding and attachment experiences are the same way. It's not a single event. They have to happen over and over, repeatedly. Sarah was saying that somebody in a class was, is that Dr. Hughes? Yeah. Daniel Hughes, who's an attachment specialist in Maine, who Sarah did a week-long intensive with him last summer, 2 summers ago, says that kids who have healthy attachments hear this harmonious, lovely music. Kids with attachment disorders or just challenged attachment hear the music from Jaws. Dun, 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 dun. That's a pretty good metaphor in terms of what happened. I wanted that goes right into this. This is a chart about attachment, not attachment disorders. We're not talking about attachment disorders. This was a study looking at 1-year-olds using what's called a strange situation. And the strange situation is when you have a mom in a room and the child and they're playing together. You have the mom leave and you introduce a stranger to the child, and you can get a sense of what the child's level of attachment is by how they react. So 60 to 70% of children in this study, and it was several thousand, were securely attached. And so the mom would leave, they would get upset, and when the mom came back after a few minutes, they sought comfort. They were able to soothe themselves, much like that infant did when the mom just kind of stared at her. Basically, when that mom just stared at her, she withdrew from that child. Then you get into insecure attachment. And about 15 to 20% were this avoidant type. They didn't really interact much with mom was in the room. They had little distress when mom left, and they turned away from mom when she come back. It's like, so there really wasn't a lot of connection there. Now that's not an attachment disorder, it's just this insecure avoidant attachment. Then there's this resistant level, which was 10 to 15%. There was little exploration with mom. They were distressed upon separation and ambivalent or angry and resistant about physical contact about when they returned. And then the final level, which was about 5 to 10%, was this disorganized, disoriented level. And they weren't very connected with the mom when they were in the room. They were the most distressed by separation. When they reunited, they were kind of confused and dazed. So you can see the inconsistency. I mean, that really does begin to have a lot more of that Jaws kind of music. It is this level of where the kids that have a lot more potential to develop into attachment disorders. Now, this has a lot of implications for us as we talk about removing kids from homes, because most of the kids that probably get removed do not have a secure attachment. So they're already at risk. A lot of them, I mean, you got to wonder about that. These stats, I believe, are from like 2003, maybe 2005. Of the 300,000 children who entered foster, well, it says 2005 right there. 47,000 were under age 1, and 103,000 were age 3 or younger. 15% of these kids were in foster care before their first birthday, and 33% were 0 to 3 years of age when they entered care. About 73%, about 3/4 of these child victims of maltreatment were neglected. Infants placed in foster care within 3 months of birth spend the longest time in care, twice as long as other children. Up to 80% of maltreated infants have unhealthy attachments to their caregivers. Well, there's the hard data, what I was telling you a minute ago. Infants are less likely to be reunified with their parents than they are to be adopted. Now that has tremendous implications. I mean, think about that 10-year-old I was telling you about. and how we need to do. I mean, he's 4 years old when he was removed, 4 months old. Disrupted attachment. Now this is important because we don't, lots of times I was thinking earlier about, if I had time I'd put you in groups and say, write down the 5 myths that we know about removing kids from homes. And one of them is, well, kids are resilient. Right? I mean, we've said that over there. Kids bounce back, they're resilient. Kids aren't resilient. They don't have the resources, cognitively, developmentally, spiritually, family-wise, to be resilient. Often. Even children with secure attachments can be harmed by the loss or disruption of a primary relationship. Children's reactions to and ability to cope with separation from a parent depend on their age and developmental stage. So just because a kid is 4 doesn't mean they function like a 4-year-old. If they're developmentally delayed, they may be functioning more like a 2-year-old, especially if they've been traumatized, because those emotional needs have not been met. Infants who enter foster care before the age of 6 months, when placed in a stable, nurturing relationship with the foster parent, may not experience harm to their social and emotional functioning. And that's based on if they get to stay there or if they have frequent visits with their family and they get to go back to them. Children placed in care between 6 months and 3 years are particularly vulnerable to separation and more likely to experience subsequent emotional disturbances. That's because that's the age when, remember, attachment's not a single act. It's an ongoing life experience. And so if that's disrupted and not continued, then I'm setting them up to be at risk to have attachment problems, and then further lifelong problems being able to trust other people. I affect their learning ability and all those kinds of things. Children older than 3 and 4 do a little better because they can cope with language. They can tell you a little bit more about what's going on. But I spend most of my life in a playroom, and I know that even 5-year-olds don't just sit down and tell you what happened. Their language is play, and they often will play that out in ways that they can't do with their language. Just, the need to think about how quickly can I do concurrent planning? Are they going to go home, or are they going to be adopted? And that's not a simple kind of thing. I know we'll talk more about that through the day. To limit attachment disruptions, very young children need to be placed in what could become a permanent home. And I know that's a challenge because we don't always have those. Just reminders about the effects of child abuse: depression, behavior problems, nightmares, learning disabilities. If you're stuck in your limbic system, your language, there's a high relationship between language disorders and trauma in children because it affects the ability of those language centers to develop. And kids in at-risk homes don't get talked to. You saw that on the video. Here's a scenario that we don't often think of, but you think about a 9-month-old who's still dependent. They need their diaper changed. They're hungry. They cry. Nobody comes. They cry, they wail, nobody comes. They cry some more. They give up. Maybe they'll try again, but they give up. So how does that affect their perception of, am I safe? Am I going to be cared for? What do they begin to already at 9 months believe about the world around them and other people? It doesn't have good results. This is the stress response. This is what they were talking about on the video. It's the neuroscience piece of, and for all of us. You have a traumatic event, and the longer that occurs, it alters our neural systems. So if it happens once, people are able to surround them, comfort them, help meet their needs. They learn that, oh, okay, bad things can happen, and I'm okay. But it happens once, it happens twice. There's a psychologist out of Greeley, Colorado I consult with, And he talks about kids that grow up in the electric high chair. They are constantly bombarded with verbal abuse, probably drug and alcohol, domestic violence. One of the things we've learned about domestic violence is if you're directly the victim, our protective systems known as dissociation, which is kind of just mentally checking out, are more likely to kick in. If I'm the observer, my chances that I dissociate are going to be less. And so I'm left to feel helpless and powerless watching the victim get abused. I feel threatened. So we know that that creates traumatic stress and a high likelihood of post-traumatic stress syndrome, which creates high levels of arousal, hyperactivity, motor restlessness, yada, 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 which looks like attention deficit disorder. So we end up medicating a lot of kids inappropriately because we haven't appropriately assessed and diagnosed. This is an interesting graph. It's an acute response to trauma, and all of this is laid over the top of development. Calm state to terror, if there is some highly reactive trauma response, and this is Bruce Perry's model, it will go up and come back down reasonably quickly with normal supports. If I have poor attachment, I have poor ability to cope, the fewer supports I have, the higher the likelihood that that response level is going to remain very, very high. And that's that cortisol piece. This line is, it's twofold. One is people that have experienced trauma will dissociate, which is they just will kind of space off, check out, pull away. The extreme of that is dissociative identity disorder, when a person will actually take on a different identity. Or there's very highly resilient people who have learned to cope to trauma. People who work in emergency rooms, on certain various law enforcement, different things, you learn to train to that. But none of us are vulnerable to that. Just real quick, this is about how memory gets stored in the brain. The brain and the body remember everything. Nothing is ever forgotten. We tend to remember highly emotionally charged things more than we do low charged things. Trauma are highly charged emotions that get stored in the lower parts of the brain. This is cognitive memory, which is the outer layer cortex. That is related to language. So if an infant is left to cry, be soiled, be unresponsive, that is all stored in these very basic layers of the brain that sets the tone for everything else. So if I have a developing brain that is damaged at these very early levels, it's the foundation. It prevents the brain from developing and being able to use its innate capacity over time.